Hello, my name is Samara Rezwan, and today I will be speaking about the poverty cycle and its role in global health. I am 15 years old and a rising junior at East High School in Wisconsin. I am also on our student council leadership team and the president of three organization chapters at my high school called Distressed Children and Infants International, Vision Impairment Screening and Intervention for Optical Needs, and healthcare advisors and liaisons of East High School. I have also volunteered for global health causes both locally and internationally, including through an organization called Burnosis, which is an underprivileged women and children's clinic and after school program in Bangladesh, where I'm the director of youth engagement and lead a program which educates and empowers underprivileged women and children. And I will be speaking about this more later in my presentation. And I'm also on my school's varsity tennis team. To begin, what is the poverty cycle? The poverty cycle is a vicious spiral of poverty and deprivation passing from one generation to the next. World Vision states that in 2020, approximately 9.2% of the world, or 689 million people, were surviving on $2 or less a day. Additionally, according to the World Bank, about 385 million children around the world live in poverty, making over half of the people in poverty children. So, to put that into perspective, that is more than the entire population of the United States. So, as the 2000s began, nearly a billion people globally were unable to read a book or sign their names. The poverty cycle greatly contributes to this by causing education to be out of reach for many, ultimately not allowing them to obtain well-paying jobs. So many individuals have to drop out of school in order to support their families, which leads them to lack a substantial source of income in the future. And this deleterious poverty cycle creates an overall increase in poverty, death, illiteracy, and homelessness, therefore making it such an incredibly important issue. So entrapment in the poverty cycle can be seen in countries such as Bangladesh, Somalia, and even in the United States. And this cycle not only deprives individuals of necessities, but research has shown that the multiple associated adverse factors with the poverty cycle creates a higher proportion of those living in poverty to experience child abuse. Furthermore, studies have shown that in countries such as India, Bangladesh, Mali, Mozambique, and Niger, half of the girls are married off before the age of 18. So this arduous cycle may cause children to develop behavioral and emotional issues such as increased aggression and expose them to crime and violence. This cycle is so difficult to break because without the previously listed essentials, it's extremely burdensome to create a substantial income, access healthcare, and escape the other challenges that the poverty cycle brings. So, being the child of Bangladeshi immigrants and having the opportunity to visit Bangladesh often, I'm able to see the conditions firsthand. And because of this, I've been aware of things such as child poverty from a young age. And I wanted to do something with my privilege. Thankfully, I was able to find a clinic and after school program that's dedicated to something I'm really passionate about, which is the education and healthcare of women and children. And the clinic and after school program is called Burnosis, which is an abbreviation for the full Bengali name, which is shown on the screen. And it's named after Begum Rokeya, a Bengali woman who is a pioneer for women's education and liberation in South Asia. And Burnosis has been dedicated to serving underprivileged women and children in Bangladesh with free basic health and wellness services. And I've been a volunteer since the current clinic and program opened in 2014, both in person and remotely, and I've been able to watch the children there grow with me. So, some of the work that I've done to help pull families out of the poverty cycle is volunteering in health and nutrition camps, leading and attending volunteer meetings, and teaching the children at the after school program basic Bengali, English, and adequate. Additionally, I recently conducted a project assessing the children who attend the clinic and after school program in order to analyze their current health and social situation. So, after I identified their concerns, I developed a program which strives to empower these children by educating them and then eventually their mothers on topics with emphasis on their biggest concerns, which were and are the detrimental effects of child marriage, bullying, health and hygiene, and more. and the program has recently gotten funding from the clinic's board, so I'm excited to drive the project forward. And we're beginning this program by implementing menstrual education. So we'll be providing them with sustainable and eco-friendly products, as well as educating the girls on how to use them, since they were not only using unsafe hygiene products, but they were also unsure of how to use these hygiene products because of the cultural stigma which surrounds menstruation. So, over 35 million people face starvation in the United States in 2020. And according to recent studies, about 22,000 children are dying daily due to poverty, making the poverty cycle brutal and persistent. However, there are many things that those of us with resources and privilege can do, since studies testify that about every 2 out of 3 poverty related deaths can be prevented. So, the first thing that we should do is educate ourselves. Things like listening to presentations such as my own, as well as external research, is one step towards change. Moreover, you can donate to nonprofit organizations, which help to pull children and families out of the poverty cycle, or even become a volunteer. And I've listed a few of these organizations on the slide. Next, it's important to destroy stereotypes which surround poverty. I'm sure many of you have heard people saying phrases like, these people are so lazy, why don't they just get a job? Or you can't give money to homeless people, they'll only spend it on drugs. And you may have even uttered these phrases yourself. So when we see poverty around us, it can be difficult to understand it and even harder to accept it. Although it's important to realize that poverty is not a choice, and unless we do something, the poverty cycle's associated economic losses, suffering, diseases, and death will continue. So by spreading awareness about global health issues such as the poverty cycle and child poverty, we're a step closer to developing leaders in this battle and breaking the cycle for those trapped within it. Here are my references. I'd like to acknowledge my family, the Global Health Leaders Conference at JHU team, and Bernosis for providing me with all these amazing opportunities and expanding my global health knowledge. And all of you, of course, for your time. And here's my contact information. Please feel free to connect with me through email or social media if you have any questions. And I hope all of you were able to learn a little bit more about how the poverty cycle is a significant global health issue and ways you can join the fight like I did. Thank you for listening.